Alright, so you don't want to fracture your tibia. That is the bone below the knee that is getting the weight from the femur, and it is bearing that weight. The fibula doesn't bear any weight from the femur, from the body, so it does help stabilize the ankle, but it doesn't bear that weight that's coming from the femur, and it's not connected to the knee joint either. And so with a bone that's receiving all that weight and it's putting it on the foot, you do not want to fracture that one. It would be better to fracture the fibula. Alright, so vitamin D levels are very important, and it helps us to absorb calcium. And this is very important. It's important for our bloodstream, and thanks to our kidneys, with help from vitamin D, we're able to have correct calcium blood levels. And when we don't have correct calcium blood levels, it can affect our ability to absorb it into the bones, which is where most of the calcium in our body is. And so if the calcium blood levels aren't correct, then we can't absorb as much calcium. It may even cause our bones to break down bones, so that it can make those blood calcium levels right. And so we definitely need that calcium, need the vitamin D to help us absorb calcium and have correct calcium levels in healthy bones. And number 3, so astronauts could have issues with their bones, perhaps because they're not getting enough sunlight, not getting enough vitamin D that way, but also because they're not exercising, they're not experiencing they're not experiencing gravity, and exercise, weight-bearing exercises can help increase our bones, make our bones stronger. So if we're not experiencing gravity, not exercising, we can have atrophy of the bones that can deteriorate. So astronauts should make sure that they're getting perhaps a vitamin D supplement and exercising somehow, engaging in load-bearing exercises, engaging in some kind of resistance exercises to help their bones.